Welcome to the Falmouth Chamber of Commerce. The Falmouth Chamber is dedicated to working on behalf of our members to make Falmouth a better place to live, work, and conduct business. We are committed to developing the economic, cultural, educational, and civic interests of our community and welcome the support from all organizations to achieve our combined goals. Whether you call Falmouth home, are a summer resident, or a visitor, we hope you take advantage of all that the Chamber has to offer.
People think that a locally owned and operated appliance store may not offer what they need. Actually, we have trained and dedicated sales associates, expert delivery and installation, professional repair service, and personal customer service. Plus, we have access to a huge local warehouse with over 6,000 models in stock. Crane Appliance. We call the Cape and Islands home. Carlson Printing for all your printing needs. 508-548-7303 or toll free at 1-800-696-7303. Our email address is carlsonprinting@aol.com. Carlson Printing for all your printing needs.
Hosting services for fctv.org are provided by MegaNet Communications. MegaNet offers a wide array of internet services including Mega Backup Cloud Service, server co-location, T1, fiber, Metro Ethernet, as well as telephone services such as hosted PBX and digital voice. Their number one goal is to keep your communications network up and running and allow you to focus on growing your business. 877-634-2638 or meganet.
Area, maybe it probably has a lot to do with the migration of birds and so forth earlier in the season. It's very rare, as I said before, less than 100 cases since 1938. Okay, most from the Plymouth and Norfolk, and I would add Bristol counties as well. There's usually an uptick every 10 to 20 years. This data comes right off the state's website. Typically lasts 2 to 3 years, the most recent outbreak being around 2012. First symptoms of Triple E. Triple E is very potent. Often a fever of 103 to 106 degrees, stiff neck, headache, lack of energy. The symptoms show up 3 to 10 days after a bite. Cause inflammation of the brain, that's what encephalitis means. And it's the most dangerous and frequent, and it's very dangerous and has a lot of complications. It's got a mortality rate of somewhere around 40 to 50%. And those who do survive never usually recover completely due to the swelling of the brain. So it's very rare. And before I get too far in, there has not been any human transmission in this sort of uptick of mosquitoes. This is all mosquitoes. Okay, but when it does occur in a person, it's life-changing. That's not what I was hoping to see. How do you protect yourself? Since the virus is spread by Triple E is spread by mosquitoes, don't get bit. That's the first and foremost. We want to avoid getting bitten. Schedule outdoor events the hours between dusk and dawn. To avoid hours between dusk and dawn when they're most active. Wear long sleeves, long pants. Next one would be the bug spray that you want to use would be the DEET, permethrin, picardin, or oil of lemon eucalyptus. All this information is on our website. This is sort of the public outreach that we've been doing, so that I think everybody knows what DEET is. It's the stuff that you get at Walmart or wherever. Keep mosquitoes out of your house by repairing all your holes, so it's a good time to check your screens because you don't want them flying in at night. Okay, sorry if some of these slides are small. It's also getting rid of the water, the standing water in your house, such as bird baths. Swimming pools that are not, if your neighbor's not, house is abandoned and there's a swimming pool that's basically had 2 years worth of stagnant water, you can call the Cape Cod Mosquito Control, they can treat it. Anything like old tires, things that collect water after a rainstorm, if we get thunderstorms like we had last night, that simple thunderstorm and within a few days could be breeding 1,000 mosquitoes. So we want to make sure we tip those over. Okay, so eliminating standing water, okay? Clearing your drains, up on your roof gutters can also collect it. Also, you're going to be on our website, and it's going to be on the state's website about control. Okay, so we want to get rid of the standing water. Again, more information, you can go on our website. You can go on to, which is falmouthmass.us website. Also, the state has got a ton of information. Okay, State Department of Public Health is where I go to find my information. There's also the Cape Cod Mosquito Control Project, which is Gabby's website. Their websites are also very good about things as well. So that's sort of where we're at with the Tripoli. Tripoli's, all you need to know, is very dangerous. It's very rare, and we have caught some mosquitoes with it. Where were those samples? This map shows the 3 locations where the 5 samples were found. Okay, 3 in Devil's Lane area, which is off of in the Nobska area. 1 over near Treetops, and 1 about 150 to 200 feet behind where we're sitting right now at Town Hall. So that's where our 5 positive samples are. We've expanded, Gabby, our sampling. We're looking at other areas and expanding it, but as we stand right now, those are the 5 that we found.
How do you catch them?
We put out traps. I actually trapped.
Excuse me,
just
Scott,
have-
we need to get a
sorry.
microphone to,
Yeah, just to
Gabby.
pick up for people at home.
Hi.
Gabby, yeah, if you wanna have
Gabrielle
a seat, you can
Sokolsky,
too.
yes,
Whatever you wanna do.
entomologist with the Cape Cod Mosquito Control Project. I have to say that I run an arbovirus surveillance program on the Cape in all of the towns. I start collecting the beginning of June, and I collect weekly. I have traps out that trap for the type of mosquitoes that lay their eggs in man-made containers that might be carrying things like West Nile virus. Those mosquitoes bite birds. Because Eastern Equine Encephalitis is a disease that's brought into this area by birds, even though this mosquito, to be clear, cannot transmit this disease, it will pick up this disease and it will be test positive if it's bitten an infected bird. That's the type of mosquito that we collected behind here. That was the type of trap. It's a trap that mimics a man-made container. Mosquitoes come in to lay their eggs there and they get sucked up into a net. The other type of trapping I do is looking at the type of mosquitoes that bite people. I have a trap that has frozen carbon dioxide in it, and as the carbon dioxide becomes a gas, it falls down over that trap. The mosquitoes smell that, think something's there breathing, come in towards that trap, there's a light, and they're sucked into a net. I have to say that these are locations, the reason why there are traps in these locations is because of the habitat and the species of mosquitoes that I see in that area. So these trap locations are historic, been collected over the 26 years I've been at mosquito control. And these are the type of habitat where they're targeted for something like this. In the 26 years, I've never found this, but that's why they were chosen.
Gabby?
Sure.
Are these the only 3 locations that you sample in Falmouth, or were there locations you were sampling that you did not find it?
No, until this week, these were the locations that I was sampling in Falmouth. Yes, for all my traps. I have traps in all 15 towns. So I have traps in Bourne and Mashpee and all of the surrounding towns as well, but yes. And so last night, we had traps out in different locations around Falmouth to see in the types of habitat where I'd expect to see the species that might transmit this disease. And we collected those today, sent those in for testing, and we should know by early next week.
And can you just, to follow up with Steve's question, that testing that you did, the traps that you put out last night and collected today, were they sort of dispersed across? I know you're looking at a particular habitat, but can you just give a sense where they kind of dispersed across that type of habitat?
Dispersed across Falmouth
Okay.
at the larger cedar swamp, red maple swamp type areas. So I added, these sites also got traps, but in addition to those traps, I added 4 more sites that are large areas with that type of habitat.
Okay, thank you.
So did you say this is the first time you've seen Tripoli and mosquitoes, human biting mosquitoes in your career? Is that, or
No,
how common is
in-
this observation?
In Falmouth,
Okay,
over the 26 years, I've had 4 samples from Barnstable County before this, total, come up positive for Eastern Equine Encephalitis. 1 in Brewster that was actually in the middle of a campground in mammal-biting mosquitoes. I expanded trapping like I did in this case, and I did not get any more positives. And I had other traps in Brewster. I didn't get any further positives there either. I had positives in the past in Barnstable, Yarmouth, and Dennis. 1 time, expanded traps, did not collect any more that tested positive.
And sorry, just so you can clarify, for these 3 spots, did you say you found sort of mammal-biting mosquitoes in all 3 of those spots, or no? Just the Woods Hole?
Yeah. It was the Devil's Lane location where I found 2 samples of mammal-biting mosquitoes that tested positive for Eastern equine encephalitis. The 3rd sample at Devil's Lane is also concerning to me because the species of mosquito that tested positive, while it's a bird-biting mosquito, is the species of mosquito that amplifies the disease in the cedar swamps. That's why that species of mosquito is why you see Eastern encephalitis passing from bird to bird and amplifying in the environment.
Yep, Sue?
How have we been treating preventively these areas up until now?
So historically, we've had a larvicide program where we control mosquitoes in their developmental stages. So we use, for the most part, a bacteria, BTI, that we put into the water. I have crews that are out there in the swamps on a regular basis, sampling for mosquitoes, and if they find mosquitoes, treating them with that bacteria, trying to keep the mosquito populations low enough that they're not causing a nuisance and not causing any sort of health concern. And when we got our first positive mosquito for Tripoli last week, the next day I had 3 crews. I have 1 crew that works in the town of Falmouth, that exclusively works in the town of Falmouth. I had 3 crews here. I added 2 more so that they could do work treating catch basins and going around to swamps. And then after we had the next set of positives come in, I had another crew come down, so we had 2 crews in this area yesterday going through all of the red maple cedar swamps, making sure that there are no more mosquitoes developing in there. So I would say we've definitely done what we usually do. That's what we usually do.
Could you go into more details what this bacteria does as a larvicide and what effect it could have on other species besides mosquitoes?
Sure. So what we use is BTI, Bacillus thuringiensis israelensis. It's very targeted towards mosquitoes. At the level we apply it, there are no direct non-target effects. It's one of the benefits of using this product, that it's so targeted. You put the bacteria in the water. We use either a backpack sprayer where the bacteria is in liquid form, or sometimes we use a granular form of it. Goes into the water. The mosquitoes are filter feeders, so when that bacteria hits the water, it starts to, all right, we'll say live. And the mosquitoes are filter feeders, grabbing it up with the hairs, the larval stage. When it's ingested and it gets into their stomach, they have an alkaline environment in their gut rather than acidic, and it starts to create toxins. There are toxins that it creates that kill the mosquito. It's 3 different mechanisms within the mosquito that ends up killing it in that larval stage. Yeah, the BTI, it's very effective, it's very targeted. It's also gone from the environment within 48 hours.
And then the dead or larva is not a food source for...
It's gone. The bacteria doesn't have a way to survive and keep it, unfortunately, for my crews who have to keep going out to these places regularly.
Because it's so limited.
There's another bacteria that we use in catch basins, Bacillus sphaericus, that will continue as the mosquitoes die, the spores are released. Again, they're very targeted. It's an advantage to using something like a bacteria.
So that organism also is effective with caterpillars, right? They also
No, it's a different variation.
Okay.
That's BT or BTK. There are different variations on it. The subgroup Israelensis is only effective on mosquitoes, and if you would apply it at a much higher rate, 3 to 4 times what we apply it at, it would affect midges because they are similar with their feeding mechanism, with the filter feeding. And they're also other diptera, so yes.
May I ask, how did the 2 samples, one at Treetops and one at Town Hall, differ from what the samples, 3 you had at Devil's Lane?
The 2.
Or the 2?
So the sample at Treetops and the sample at Town Hall are I'm just double checking all of my notes because I keep saying the same things over and over. those were collected in traps that were aimed at catching mosquitoes that lay their eggs in man-made containers. Those are the type of mosquitoes, like I said before, that bite birds and people. They tend to transmit West Nile virus, but they are not the type of mosquito that can transmit Eastern equine encephalitis. They just bite the bird, pick it up in the blood, and then will test positive for it because a bird in this area, or birds in this area, have Eastern encephalitis.
So based on your results, the greater concern is in the ones you're talking about that were more in Woods Hole, I guess?
Definitely.
And so the two that we were just talking about in treetops and town hall do bite humans, but they don't transmit the disease to humans.
That's exactly right,
As
yes.
opposed to the two in Devil's Lane bite humans and are the type that can transmit the disease.
That's exactly right. They don't fly very far, so it really does mean there was a bird here, very close to Town Hall, that was carrying Eastern encephalitis.
I see. And is there a danger in that bird to a human?
No.
No.
Except for
You
other
get the
mosquitoes.
disease from a mosquito bite.
Got it.
Sue?
What is the next level of treatment beyond what you've already started, which is to sort of step up the current level?
So, okay. Oh, okay, go ahead.
Well, I guess we need to go into it right now.
Here.
Scott,
I'm close,
get
Scott.
the mic.
Just to get a, because some of these are on the slide, so I just to show you. If you see this colored chart, the orange is high. We're currently blue low, but as of 2:45, we're considered moderate, which is the yellow. And what that'll lead you to, and actually that's from the email, as of 2:45, we're considered a moderate risk. That's a number of EEE mosquitoes, 210 that's been caught in the state. This is a little tricky to read, but this is from the state Mass Department of Public Health's guidance document. And number 5 says, if already in progress, standard locally established, actually I could probably read it right here, that would make it a lot easier, right?
Yes.
If not already in progress, standard locally established adult mosquito vector control efforts included targeting ground adulticide operations should be considered, because it does indicate human risk. The decision is, so that, what I'm saying is the next step would be a targeted truck spray if we went to another level.
For the adults, because
Right,
so
so you're
far
gonna
we've
be
only
the
targeted the
spray would knock down the adults.
Exactly.
And so that's where, when we're in low, as we were as of, I talked to Dr. Brown at DPH, and she had said that we were gonna go to moderate today. And Gabby had known this was gonna probably be because of what, the combination that we've had. So that's why we had the meeting today, is because there's going to be a request to target spray certain areas. And so I thought maybe that would be the best to, now to get a little ahead of myself from a legal standpoint, we've given control of mosquito treatment to them. But as a courtesy, they've always come to the towns to ask for whether they would like it or not. So
Whatever
that's where we're at right now today.
So I'm here to give my recommendations and to let you know what my board's policy is, but it's up to the town of Falmouth what you feel we should do.
So can you tell us what's meant by truck spraying? Growing up, playing outside, you would literally just see the truck spouting gas come by. You would not even ever have a prior notice or close the windows. Are you literally talking about like a truck putting vapor out, or are you talking about something different?
So things have definitely changed a little bit. There would definitely be notification. There's no legal requirement for notification with the Commonwealth of Massachusetts as a mosquito control project. We are allowed to truck spray. If we would move forward with a truck spray, if we felt that we had reached that point where a truck spray was necessary, we would definitely need to do a notification to all of the residents. But yes, I'm talking about at night when these mosquitoes that are carrying this disease are active as adults, out there flying, biting, we would bring a spray truck through. I have to say,
That's someone driving a truck on your street with the vapor coming out of the truck.
that's exactly what it is, overnight, yes. In my 26 years at Cape Cod Mosquito Control Project, we have never done that, we've never recommended it, and I don't actually have the equipment to take care of something like that. Through mutual aid, I've contacted other mosquito control projects in the Commonwealth of Massachusetts, and Central Massachusetts Mosquito Control Project is willing to offer us mutual aid should we choose to take that next step.
Yeah, go.
And how do you decide the borders? Is it, you know, it wouldn't be Greater Falmouth period, just up to the border of Falmouth, how do you decide?
We would target it to the areas where we're picking up positive mosquitoes. So at this point, it will depend on how the results come in from the traps that we put out in town. I would say this all is contingent upon traps that we put out last night coming back either positive or negative for Eastern Equine Encephalitis. My commission put into place a contingency plan a number of years ago that said that if we had sustained mammal-biting mosquitoes with Eastern Equine Encephalitis in an area, their recommendation would be to bring in a truck to spray.
And is it a mile beyond where the mosquito was found, a half a mile? What are the guidelines?
There are no guidelines, really. I would target the streets around, especially around that Devil's Lane area, all the way up to where I've gotten positives. So I've got positives from that area up to here. I would keep it very small, as small an area as possible, just to target where we found positive mosquitoes.
Because just to sort of clarify, even though around here you found non-mammal biting mosquitoes, the fact is there's a bird that has triple E that mammal biting mosquitoes that are also here are going to probably bite.
That would be my concern.
That's why it's still an area of concern.
Even though that mosquito can't transmit the disease, that means birds are here with that disease and other mosquitoes are biting those birds.
What's the mortality for the bird?
Native birds do not show any symptoms to this disease. Non-native birds like pheasants or there used to be emu farms. That was a popular thing. They have high mortality
So they're
from
going to
this.
hang around for another couple of months, and this will be an ongoing problem.
This is going to be an ongoing problem. Right now, the level of Eastern Equine Encephalitis is very high in the Commonwealth of Massachusetts, and I'm sure you've all heard the news. They are going to be doing an aerial spray starting tonight, depending on weather, in areas of high risk. The State Department of Public Health has considered it a health hazard, and they're going to put up planes to go over those areas of high risk between, in the next week or so to cover those.
Could you go back to the map of Massachusetts? So the areas you're talking about, they're likely going to be doing the aerial spraying, are
Bristol and Plymouth County, yes. A number of communities.
Can you give us an idea of what the level of mosquitoes found in that area compared to Falmouth? And I mean, there still haven't been any human cases of it in those areas either.
And so that's what we're trying to avoid.
Right.
So in 2012, when last time they had an outbreak of Eastern Equine Encephalitis, I was talking to the state today, and one of their comments was that within the area of spray, there were no deaths, and there were no cases. Outside of the area of spray, there were cases. At this point, we are at peak transmission for this disease. It's going to continue to amplify. At this point, when the town of Falmouth is officially raised to the moderate risk level, it will remain that way now until there is a hard frost. The disease is here.
What other animals or, like for example, are bees affected by this next level of truck spraying? Is it a different chemical?
So we would choose something. Okay, we would choose something. This is what's currently being used for truck spray. As you said, off Cape and in other communities in Massachusetts, truck spray throughout the summer is a regular thing. It's not in response. It could be in response to disease, but it's also in response to high mosquito populations. This is a product that's also being used in New Jersey and other states that are currently experiencing high levels of Eastern Equine Encephalitis. This product is sprayed at night when pollinators are not flying. So you try to avoid exposure and contact that way. Once the spray dries, it does not affect bees. And if we would choose to go to that next level, I would certainly contact the Barnstable Beekeepers Association to let them know. I suspect that they have an email group that they could put that information out.
And so just to get a sense of what your thoughts are, I know it sounds like you're waiting, your recommendation that you would give to us would be based on your results that you get from your traps last night, or are you ready to sort of give us a recommendation about what you think your board would suggest?
I think that Eastern encephalitis is in this area, and it's in mammal-biting mosquitoes. I think that there'll be more evidence next week. I think that there's enough evidence now that you should at least consider a truck spray. It's up to you. I would say
Since-
definitely, if we got positive next week, definitely.
So you mentioned we don't have a truck ready to go. How long would you imagine it's gonna take to get your subcontractor if we decide to go with the trucks?
So it's another Commonwealth agency that would help us out with mutual aid in this situation, and we've talked to them about the potential. They also have Eastern encephalitis in their region, so it's gonna be sort of when their trucks are available. They said that they could be available to come in on Wednesday of next week at night, should we choose that. And then the next date would be the next Monday. So August 14th and August 19th were the two dates that they gave me. One of the things is if it's raining, you can't use the truck spray. So it's a weather thing. And I don't know if they know the weather now till next Wednesday, but it looks like it might be raining anyway next Wednesday, or this coming Wednesday.
So sorry, go, Steve.
No, you had your hand up first.
Yeah, I guess one of the things that I'm wondering about with, we've kind of started talking about spraying, but there are other mitigation strategies, like, for example, encouraging folks to use bug repellent and things like that.
Certainly.
So could you comment on, because with this approach, you're going to kill mosquitoes that might never bite a person, even if they're a mammal-biting breed of mosquito. They just might not ever get there, right? So
This is true.
So I guess my question is in your experience and throughout the Commonwealth, what are the relative kind of cost benefits of, public information campaigns about bug spray and staying indoors versus this as a mitigation
I
strategy?
think they're important. Like I said, the only thing I can compare this to is 2012, where I think it was all over the news, the information was constantly out there. Wear bug spray, avoid spray. And still we had a number of people who came down with Eastern equine encephalitis, a number of deaths. And within the spray area, that didn't happen.
Mm-hmm.
I definitely agree. I was glad to see that there are people here from the press today, and we've talked to a lot of people. Your Board of Health has been great with getting the information out. I think the more you do, the better, to warn people that they need to take this seriously. It's not just mosquitoes biting you on a summertime evening. It's mosquitoes that might be carrying a disease that are biting you, and a serious disease at that.
Following along with everything you're saying, down this path of, spraying those specific areas, and then you said that until we get that 2-hour or 3-hour overnight frost, there's a risk. So are you advocating a regular spraying regime until the first frost, or is this a one or two time?
I think you've got a good combination of the aerial spray is going to happen between starting tonight and going on. So hopefully they're going to reduce risk in the places where it's high levels of Eastern equine encephalitis. I'm thinking one time to knock down whatever's flying. We're out there controlling what's developing now in the swamps, but what we're doing is not killing the adults that are flying right now that might be carrying the disease.
And,
One
I'm sorry,
follow-up.
yeah.
How long does an adult mosquito live?
Okay, you're asking an entomologist. It's different for every species. In general, on Cape Cod, in the summertime, 2 weeks.
The other question I had was just in terms of how long does the virus live in the bird? Does it just does the bird it's a carrier?
The bird is a carrier.
Okay.
That's why it continues to grow throughout the season. And actually, I think that a lot of times what you see are more cases later in the season where people are not being bitten by mosquitoes as often, and they're not thinking about repellent. Right now, if you go out and you're being bit by mosquitoes, maybe you are thinking about putting on repellent, but it gets to be cooler nights and you're only seeing 1 or 2 mosquitoes. Those are actually more likely to be transmitting disease.
Can you test for the bird to see if the bird is infected?
There's nobody doing that testing.
I mean, another option would be if the bird is sort of the carrier of the disease, if there were a
There
limited
are a
number of birds.
variety of bird species that are actually out there carrying. It's not like one bird, or it's a variety of species.
With respect to the aerial spraying, I thought you said Bristol and Plymouth County?
Bristol and Plymouth County.
So how is that gonna affect Falmouth? You mentioned that it was gonna help us
In
out.
general, what you have right now is a very high level of Eastern equine encephalitis in the Commonwealth of Mass. If they could stop that from amplifying in the bird population, get rid of the mosquitoes that are carrying it right now, it's at a high level now, but if you could stop that cycle, I think it would help us here, because I think that that's the map's not, but I think that that's what's happening. You're having birds move from that area of high risk into this area.
Okay, thank you.
Any other
I have
questions from the board?
one other question. So, after the one time of spraying, is it your feeling that with amplified applications okay, so another question then would be, do you intend to amplify applications of the microbial larvicide?
We already have.
You already have?
We already have. That happened as of the first positive pool of mosquitoes in this area. That's already happened. So it's just that we've got those. We'd like to reduce the risk. I'd like to say that by doing what we're doing, it's reduced already. I'd like to say that if we found we needed to do a truck spray, that it would be reduced right away after that truck spray, but it's nature. You do the best you can with the information you have.
Can you give us any feel as to what the number 5, I mean, it's 5 mosquitoes, is that 5 out of 5 parts per?
Oh, you mean out of the samples?
Yeah, I mean,
So those were samples, those were groups of mosquitoes. I tend to say pools of mosquitoes, but people mistake that for swimming pools of mosquitoes. So samples of mosquitoes, they were grouped together. So with those mammal-biting mosquitoes that we collected, one sample size was 50 mosquitoes, the other was 17 mosquitoes. The testing that they do at the state lab is either positive or negative.
Okay.
So I don't know whether it was 50 or one mosquito. I don't know if it was 17 or one mosquito, but just the two samples.
And it is 100% of our traps tested positive. We have 3 traps, and all 3 of them were positive,
Oh,
or 3 locations.
3 locations, yes,
so it's
yes,
Everywhere we're testing, it's found.
yes. That's unfortunately the
Right.
case.
Thank you, we got quite a bit of information from Scott before this meeting. The Zenivex that you
Yes.
showed up there
Yes,
to use, I'm reading that it's a variant of the pyrethrin,
Yep.
which people buy to use to repel mosquitoes anyways. Is that what you will use, or would you use something different if this wasn't available? You know that that's available.
this is available, and this is what the group that's offering Central Mass that's offering mutual aid has been using. This is what the other mosquito control projects are using in Massachusetts. This is what the sprayers are calibrated for, is the use of this
It may be a question that you
product.
can or can't answer, but in the product literature available, it states that the active ester in it is estofenprox.
Yep.
And it says it's considered a non-carcinogen, a non-teratogen, and non-mutagen. Who determined that?
That would be EPA. Those are EPA classifications.
Well, that's an EPA designation. Okay.
Yes, it's based on, it's based on evidence provided by the company and then reviewed by the EPA.
So
And it is, of all the products, it is considered a reduced risk pesticide as well, and that's a classification that the EPA gives out.
The idea of the mutual aid is coming from central Massachusetts, which are in the remote to low areas, is a little bit reassuring that they're keeping it.
So they did, even though they're at remote to low, which is what we usually are, they did just this past week have a number of positive EEE mosquitoes come in. I think they had 6 samples come in.
Yeah, the email I got included Southbridge and Westboro, so by having
Yes.
2 towns ticking, because we were on that email, that would indicate that they're starting to get an uptick as well.
Exactly.
So I have a question, because I'm just looking, and you mentioned it, so I just was curious to take a look at the weather. And it does look like, I mean, I know it's a bit
does
far
look
out,
like-
but it does look like it's gonna rain. So if this were the avenue the town were to go in, or go down, and it's not available Wednesday, then we have to wait till that next Monday?
Monday,
Okay.
Monday the 19th. Yes. Oh, sorry.
Go ahead.
Sorry, I just gotta keep coming back to this. I mean, you said something that was really interesting earlier. You said that in the areas that were sprayed, there were no cases. But in the areas that weren't, there were cases, and this was in the outbreak of 2012, if I'm understanding you. So I think that tells us that even if we go forward with the spraying, it shouldn't give us all that much comfort, because unless you're in a spraying area, if you just extrapolate from 2012, then you're still at risk. And so I think that
The risk is never going to be zero.
right, yeah, no, I acknowledge that.
And
But
what we're doing here, what I'm talking about is reducing the risk.
Sure.
That's all.
and so I'm again just trying to redirect the conversation here to what individuals can do,
Definitely.
to protect themselves. And I just want to make sure that whatever action comes out of this meeting, that in parallel with that is some kind of public relations or other mechanism to let people know what they can do.
I agree,
reduce
and
their
one of
risk.
the things we've talked about is the fact that we can encourage the curtailing of evening activities.
Yeah, so, well, get to one of the slides we had. So when you get into when I had up the DPH's sort of guidelines, curfew usually comes when we're in the high and severe, I don't know if any towns currently in the high area are doing it right now.
yes.
I believe it might have been Rainham, I'm not quite
A
sure.
number of the towns already are.
Yeah, so if we got in, I think, we could discuss that. I mean, that is like a second phase to it. The school department we brought today to listen as well, because school's not that far away. My daughters have band camp coming up pretty quick for marching band, so it is coming up quickly. It's generally reserved more for and correct me if I'm wrong, the high and more severe classifications.
It is.
Which we're at moderate, but it is something to consider, which would be curtailing sort of town, sponsored things in the nature that would be at dawn, at dusk. It's not really part of the moderate at this point, but again, of course, you could go a little bit further if you so chose, if you feel that the public information we're getting out about mosquitoes, because as Ben said, is if if everybody's, coming to band camp for Spanford at night for the band rounds, with bug spray on, we're gonna be in a lot better shape because the information's gotten out there. So hopefully, you can consider a curfew.
And this is the time of year, hopefully, because it is, I don't know when our first hard frost is probably not gonna be for a really, really long time.
Yeah.
So, certainly as kids get some of that back-to-school literature, it's something we can talk to the school department about in terms of doing some coordination with some awareness and educational piece for kids who generally are the ones who are out at that dusk time engaging. And even if they're not in town-led activities, they're out and about as, they normally would be, so. Sue, did you have something?
So in terms of what
Yes.
you would be looking for from these boards today, not just an approval of the recommended action, but in the event that it did go to high and severe, you'd also want permission for the next action to be taken.
We hadn't thought that far, I think.
No.
I think right now what we're looking, what I was asking because of the request was whether the Board of Health and the Board of Selectmen were in agreement that that the targeted spraying was it. And I think that's where we're at right now, is the targeted spraying. I don't think you're recommending the curfew at this point.
We're hoping to reduce risk and not get to the point where
Okay.
but it's never gonna be zero. The more you can get the message out, the better.
Sam? And then I will take any questions or comments from folks who are here.
I know in my family, there's some prejudice against DEET. I mean, I've been an active hiker for 15 years, and I always used it because the research that I've read indicates that it's the most effective, insect repellent. But I still have family members that say, well, no, my children can only use Skin So Soft, because that's sort of the... And I just wanted you to weigh in on that, because there seem to be some parents that feel like DEET is a threat to their children. Could you tell us what the public health research suggests about the use of that kind of bug repellent?
So there are a number of different repellents that are approved by the EPA for use as being safe and effective if used by the label. Skin So Soft has one of these active ingredients in it. Most formulations of it do. It's finding something that you're comfortable with. Any of these on this list have been proven to be effective against mosquitoes.
Thank you.
So it's mostly, I would definitely encourage the public, should they be out there looking for a repellent to choose, you need to look at the label on the repellent and make sure there's an EPA registration number. That EPA registration number is your guarantee that it's been tested and the data shows that it's effective and it's safe to use. I cringe when I talk to people about Lyme disease, the county extension. They work a lot to educate people, and they find the same thing when people are looking for repellents for ticks. You really can't go with something that's that natural product unless it has the EPA registration number on it. You can see oil of lemon eucalyptus is approved.
Thank you. So maybe we can just, unless anyone else from the boards had questions this time, if anyone from, yep, Mark, come on up. If anyone from, and then Mr. Finneran, you in the back, just want to come on up and just make sure you introduce yourself, please.
Afternoon, Mark Kaspersik, conservation agent. I just had a question on the spraying then. So when they go out with the trucks, assume they have like the wand spraying and then it's all rolled up on, you know, where they can get into a swamp a lot further than they could otherwise with.
It's, as you can look up pictures online. It's what Susan said. It's a truck that drives down the road, spraying out of the back of the truck, an ultra low volume mist. So it'll be a mist coming out of the back of a truck. It depends on the wind, how far it carries it.
So, because the main issue is with water bodies that, you know, to get, you know, mosquitoes that are breeding in these areas, so.
But my understanding is you're getting the sort of product of that breeding with the bacteria that you're using. And so you're just trying to catch the ones that you're not catching with your other, the ones that have kind of slipped through and have grown to maturity. That's the hope of the spray.
Thank you.
Yep. Mr. Finneran?
Mark Finneran, you said that your sampling varies, you know, 50 in one case, 17 in another, and they're only looking for a positive. When you do, from your experience, when you do find that a water body is positive, how likely, and we don't know what the percentage of the mosquitoes in that body are infected, how likely is the thing gonna proceed to 50, 60, 70, 80, 100% of the mosquitoes? I mean, once it's in the pond, does it eventually affect all the mosquitoes, most cases? I mean, just a little bit of arithmetic.
So the disease is in the adult mosquitoes, not in the larval mosquitoes that are developing. It's only in the adult mosquitoes, and it's coming from it's in those adult mosquitoes that have bitten birds. So it's not necessarily something that you could come up with by any formula. It's just a matter of percentages. How many birds in your area are carrying that disease, and how likely then are they to be bitten by these mosquitoes that are picking them up? So it's hard to estimate. No, nobody's testing the birds. It's too many.
But nobody's giving us a percentage of the mosquitoes that are infected either. It would be nice.
There actually are some, the state is running minimum infection rates. That's one of the ways they gauge disease in the area. They run it statewide though. They don't necessarily run it for one single area.
So everyone should exercise on the side of caution.
Definitely, definitely.
Sir, did you want to make a comment?
Good afternoon, David Zonner from Woods Hole Golf Club. I'm the general manager. My question is, we sit less than a quarter mile away from where you tested these. We have a lot of wet areas on our course with very limited road access. How would a targeted spray affect us, and would we need to have other methods in order to ensure that our entire property was covered?
Great question.
The targeted spray, as you said, will be limited to where trucks can go. I think we've worked with you at your golf course in the past. We'd be happy to send crews out into the golf course to make sure that there are no mosquitoes coming from any of those sites. I'd be happy to have somebody meet with you tomorrow. Done.
Wendy? Yeah.
Hi, Whistler Oyster Pond Environmental Trust. I also had that question about inaccessible areas that you couldn't get a truck down. But my other question is, are there any other nocturnal animals that would be out when you're spraying in the evening? You know, there's like bats, there's moths, there's other kind of critters that are out at night. I just wonder if they would be impacted.
So this is an insecticide that would impact other insects, especially because of the level you're applying it at, especially small insects. Because mosquitoes are so small, the amount that you would use, the toxicity level does not have to be very high because mosquitoes are so small. It may impact other insects. It would not impact. I haven't seen any studies that show that it would impact any vertebrates or anything like that.
Yep. Sam?
Yeah, I have a question. I mean, the golf course, the Woods Hole Golf Course just came up as an example. I mean, can private entities actually choose to spray on their property and under the law as it currently exists?
So you can hire, anybody can go out and hire a private contractor. And to be honest, there are a lot of private contractors out there right now counting their bucks. I would be careful when I hire a private contractor. There are some horror stories out there. I would make sure that if you're going to hire a private contractor, you make sure that you find out what product they're using, get a label, get a safety data sheet. Make sure everyone working for that company who's coming onto your property has a Massachusetts state pesticide applicator's license. Talk to them about it, because we've had some stories even on the Cape with misapplications where I cringe to say it as an entomologist. I love all insects except for mosquitoes carrying disease, and one of those companies ended up killing honeybees. I really would be careful with who I hire, and I would make sure that I educate myself before anyone sprayed anything on my property. A lot of those products are temporary. Mosquitoes fly, whereas you may find them working very well for tick applications because ticks have to walk across them and come into contact with them. Spraying your bushes is a temporary solution. Mosquitoes fly around that spray.
Can other private entities contact your organization the way the golf club, if they have large bodies of water?
Anyone can call my organization before or after this EEE incident occurred, and what we do is, as a general practice, anyone who calls us, any citizen, any company, anyone, I send the crew out to their area to look for where the mosquitoes are coming from. They go to the location, they take samples, they identify the source, they treat that source with BTI. Not gonna get rid of the adult mosquitoes right away, but it's gonna make sure that you don't have mosquitoes in the future.
Because I think there are a number of places in Woods Hole where the entire water body is on private property, and that you may not be treating it right now because it's not accessible to you.
It depends. We do a lot of work in Woods Hole. Our legislative mandate allows us to cross private property. Again, we don't force our services on anybody, but we have over 400 sites that we're checking and treating in the town of Falmouth on a regular basis.
Just to add that if they call the health department, and if there's a private citizen with a lot of wetland property, so to speak, I could relay that information over, because that's what we've been doing for eons at the health department. If someone complains, like I said earlier, about a pool that's been abandoned, lots of mosquitoes, I'm calling it over for that. And also the converse is, the opposite is true. If you want to opt out, if we decide to go with spraying, there is you can go on the state's website. We'll put this on our website and the town's website, is the main site, and also on our health department page, where you could actually opt out if, and they'll have a GPS unit in the truck. Somebody from their office would be there, and what they would do is exclude certain areas if someone chose that they did not want to be part of it. So there's also an opt-out ability to do it.
Exactly. That's something where you can go online. I have some forms with me now, but you can go online to the state website, and what would happen is you'd give them the information. If you want to opt out from a spray like a truck spray, please make sure that you mark adulticide. The form will allow you to opt out of any of our services. Make sure that you mark which services you want to opt out of, because
There's some really
we
important
will-
ones if you don't like
yes.
the spray.
and make sure that if we would do this, if anyone wanted to opt out of it, there are signage requirements so that we can put the information into a GPS with the trucks that would tell us to turn off the sprayer when we got within the buffer of that property. But we would also run the route during the day to make sure our crews knew where it was. I'm not gonna depend on technology to tell me where no sprays are. You put out the signs, we'll make sure we don't spray any property.
That's great. Sam, I think, had a question.
Well, actually,
comment.
an observation that if there are private entities that are spraying, I mean, that spray could easily blow across onto your property. So we're really talking about, your organization, which is taking a very conservative and targeted approach versus a much larger private entities, or cohort of private entities that are going to be spraying on their own beyond the control of you as an individual property owner. And also the environmental concern, which I share. But I think the reality is, you're not the only ones that are going to be spraying. And so if you start restricting yourself, which is increasing the likelihood of EEE spreading, or those mosquitoes having opportunity to bite a human being, you have to recognize that it's not just your entity that's doing this. There are a lot of other private entities who are spooked by this and who are going to be out there spraying as well. So I think the reality is we have to see the big picture here. It's not just one entity that might be spraying and doing it very conservatively, but we've got a whole private group of people that are doing the same thing, and perhaps, as you pointed out, not in as controlled a way.
And also, just to sort of underline what you were saying and Sam's point, that, the approach that you're recommending is specifically for mosquitoes. And I know a lot of companies that provide those services for backyards, they'll lump everything together. So it's just what you're saying. They'll say mosquitoes and ticks, and they sort of spray the surfaces of things, which isn't really a targeted approach for mosquitoes. So I know there are going to be people out here who in the public who get really worried, exactly as Sam's saying, and call, but that approach is not necessarily as effective, never mind the other negative ramifications. So just so people are aware of that.
I'm going back to the basics right here, and maybe you already said this and I missed it. But if my neighbor's got a bird bath, and the bird bath is breeding mosquitoes, how far will those mosquitoes go? Will those mosquitoes from that bird bath stay within a half-mile radius, or do mosquitoes travel large distances? Because I'm back to, if you find it in a couple of locations and you're treating those locations, are the adult mosquitoes traveling until we get to treating it? Are those adult mosquitoes spreading around?
The birds are, though.
So
Birds are moved, but I just wonder about the mosquitoes.
So it depends on the species of mosquito.
That's the answer you gave me last time.
Sorry. Again, entomologist, I can't help it. I'm all about the mosquito facts. The species that we collected in, the culex, the container breeding mosquitoes that are not transmitting it, those don't fly very far at all, less than half a mile. The other mosquitoes that have tested positive for it most likely are not flying more than a mile from the site where they are.
Okay.
Is there any action required tonight?
I think Scott's going to get to that.
I guess, I don't think I need to accuse myself, but I guess I will disclose that I live at Treetops where one of the mosquitoes was found.
Irie, I don't know if you met Irie, she's town council
Yes.
now, right? So we kind of looked
Where's
up.
your long
Hi.
sleeves?
So what we kind of did is look at the Mass General laws. Oh, Irie did, thank you so much. Not being very good maybe as an attorney. So under Chapter 111, Section 122, it gives the Board of Health sole authority to declare a public health nuisance. So to go back originally, no, their contract allows them to do it. The Board of Health could tonight take the action using that. And actually in Section 111, 104, it can be done in conjunction with the Selectmen. So, do you have to take a vote? No, I just think for trying to get ahead of this, I think, making a decision tonight that you would support targeted spraying is what I presented to you tonight. And if you would allow that to give them, and then the targets are going to vary and going to change. Okay, so, and then we would, as the health department and Gabby, and Julian's gonna need to help me on this, is getting it out and getting the information out, and like I did over here, my last slide was things like reverse 911. I know the schools call us a lot, you know, press releases, websites, and how we're gonna have to like disseminate the information as we go, so.
Great.
So I think, you know, if you guys would like to take a vote, or at least give us some support that, one way or the other.
Sure. Does anyone on the board have any feeling about that?
I think I'd like to authorize it. I'm gonna make a motion that we authorize targeted spraying if they determine that it's necessary.
Second.
Okay, all those in favor?
And one thing
Oh,
I'd
I'm
like
sorry.
about that is that we also know right now what date we're talking about. It is either gonna be next Wednesday or the Monday after it. So from getting the word out,
Yes,
whether
good
this is
point.
gonna happen, the only 2 days it could happen, at this point, maybe further down the road, if it rains both those days, we'll have to come up with some other choice dates, but we can already start publicizing, this is the vote, and be aware that this is when it's gonna happen if it does.
Good point. Any other discussion on this?
This is targeted truck spraying.
Yes.
Right.
Mhm.
It doesn't have anything to do with a curfew or anything going, you know, it's just the targeting spraying of the areas.
Okay. Any other discussion by the board?
Can I ask one clarification? And that's, the areas are to be determined by Gabby and her agency based upon test results.
Absolutely.
Correct.
Thank you.
Yeah.
Quick question, the provision was skipped forward, it's not still up there, but does the Board of Health make a similar vote at this
Yeah,
point in
I
time?
think, yeah,
we make the motion.
you
We
guys
actually-
take your vote, but I think I have a question for Scott to come back to that first line up above.
That
It
was my
looks,
question.
it looks to me that they don't really even need us, but,
That's what I tried to say
Yes,
before. They
yeah.
don't, but but they would
but
like.
it makes
they-
a statement, and it's an educational piece, and it's a support piece, and obviously, just getting this information out, and for, the Board of Selectmen to have the information that you are obviously privy to, is the point of this, so.
To clarify Sue's point, we may not have any further information before next Wednesday. That the test may not be back in time for us to have, because you said sometime next week, they're gonna have the results from last night's.
Tomorrow, right?
Monday or Tuesday, we'll have the results.
We will, so, okay, so we will have the additional information.
Definitely,
Great.
And that will help to guide where you're gonna actually spray.
definitely, yes.
Okay. Any further discussion? Okay, all those in favor?
Aye.
Great.
I'm chairing, I guess, so the Board of Health, I think I need to get a positive motion from somebody to declare a public nuisance from the positive test for AAA.
Yeah, I'll make the motion that the mosquito-borne EEE threat is a public nuisance, and give the Cape Cod Mosquito Control Board the authority to deal with it.
They have the authority to support.
Yeah, sorry, the support to deal with this public nuisance.
I'll second that. All those in favor?
Aye.
Aye.
Thank you for your support.
Thank you
Thank you for
very
your
much.
service.
I will keep you updated
Yep.
Yeah,
throughout.
yeah, I'll just keep contacting Julian and you guys. If you guys wanna be all on it together, I'll filter it through Julian, but anything we get, we'll just keep forwarding it over.
Yeah, any information you can send to us, then obviously we're not gonna comment on it
Yeah.
because of open meeting law, but you can
Right.
keep the information flowing. That'd be great.
I guess go ahead.
Go ahead. No, sorry, just not to belabor the point.
Yeah, say it
okay, but
again,
we've
because it's
kinda-
really, no, it's really
We've talked
important.
about spraying here, and that was what I think
Yeah.
just happened, but what you did bring up, the reverse 911, the school calls, will that be part of the response too, and you'll coordinate?
That's gonna be, I wanna find out the best way to let everybody know if it's
Yeah,
gonna be in your
for sure.
backyard. Yes, obviously, you know, I think we can figure out the best way to do that.
I'd just like to say, as part of that communication, I mean, Gabby described to us, and others have, exactly what the recommended individual actions are, and those have to do with protecting yourself
Right.
from being bitten, using DEET or other sprays, staying away from certain times of day, putting on clothing that protects yourself from being bitten. But it doesn't say spray your yard with pesticides. And I think with this amplification of fear, that's gonna happen. So I think with these communications, it would be useful to include that additional piece of information with the communications.
Sorry, just to clarify, are you saying that folks should apply pesticides to their lawn, or
They
shouldn't?
everything that's been said this evening, people should not apply pesticides on their own or hire contractors on their own to apply pesticides to their private property. Instead, they should contact the mosquito control commission in order to get guidance.
You can actually come and test. I mean, I think the difference is you can actually come to a property, I think you were saying earlier, if people, and you can test the mosquitoes on that property. And then those folks can then act from a place of actual knowledge.
Exactly. So I'm not saying necessarily that nobody should have their property sprayed by by a private contractor. I'm saying you gotta be smart about it if you're gonna choose to do that.
And I would just say, I think that there's a great resource, so you can know, whether or not you're, it's really something that's sort of at that high level of concern, so.
Yes. And I would suggest that if people want to be excluded from the spray, that they go to the website sooner rather than later so that we can get that information started through our system.
And all of this is on the Board of Health's website?
I didn't put this link on just in case if we decide after tonight, now we'll put the link on.
I'm just thinking, I'm sure a lot of people haven't copied down the
I wanna
link for
put
the
the link up
opt-out.
prematurely if you decided you didn't
Yes,
wanna do the
yeah.
spraying and
No,
have the link
good
on
point.
there.
Good
So
point.
that's why we did it that way.
Okay.
Do you have a phone number that people can, or a website
Yeah,
that
we'll
you
put
can actually
up,
put up now?
Yeah, we'll put links up when we're done here tonight.
It's on one of the slides, right?
Yeah.
I think Sam is just saying if people are looking at it right now, but
Yeah.
then.
Oh, sorry.
Yeah.
Oh.
If somebody wants to write it down right now.
Even then.
That's those
Because-
that are actually
Gabby?
tuned in.
Yes.
I just want to compliment you and all the people that work with you. I'm always amazed when I discover that something's been happening that I don't know about. And so the fact that I know so little about what you're doing tells me that you've been doing a really good job at what you're doing. And I'm also impressed by the response by both town staff and your staff, that the time from when you first realized that you got positive hits to us sitting here, finding out how we can support your efforts, compared to how some things work in government, this has been remarkably quick. So I compliment you on the job you do.
Thank you.
Here.
And did you have anything?
Oh, nothing more to add to what Steve said.
Madam Chair, could I
Yes.
just clarify? I want to make it clear, the town does not possess a standalone reverse 911 system. We
Correct.
operate in collaboration with the county sheriff when we utilize that, so I
Right.
want to be cautious about folks' impression about that.
Yes, but we do have the school, the calls for the schools. I mean, I think there's lots of
Right.
options. We've looked at some of
I
them.
Plenty of
brainstormed at the
communication
end of
options.
this PowerPoint and said things
Yeah.
that I thought of that we would, during.
So, no, I think that the point is just there'll be lots of ways to do it, but that the public education, because this isn't gonna be over next week after they spray, we're talking about many months that we have to be sort of vigilant. So the educational component is probably gonna take lots of forms. But thank you for clarifying so people
Absolutely,
realize that.
thank you.
Any further comments from the Board of Selectmen?
Could I make one further
Okay.
comment, Madam Chair? I just want to commend our health agent, Scott McGann, and Mary Langler, his associate. They met with me very quickly when it became clear that this was an issue. And Madam Chair, thank you. I spoke to you shortly after, as you know, and we talked about setting up this special meeting to discuss this and be ahead of an issue and ahead of the curve. And I want to commend Selectmen and the members of the Board of Health and my colleagues, and Gabby as well, who I've worked with mostly quietly in the past, but here a little more overtly, for the great collaborative effort to notify the public about a potential risk and allow them to work with us in managing that risk, and that's really what it's all about.
Well
Thank you.
said. Thank you.
Move we adjourn?
Second? Yeah.
Yeah.
They did.
With 3 positives. What's that? 3 ayes.
Unanimous.
All those in favor?
Aye.
Aye.
Great, thank you.
Adjourn.